Good evening, all. Welcome to Netscare YouTube channel. So today we will be discussing some of the important questions for the staff nurse PSC insurance exam. First question: Florence Nightingale was born on option A, May 12, 1920, option B, May 12, 1820, and option C, May 12, 1810, and May 12, 1830. So here you can see that the date is same, but the year is different. So the correct answer is Florence Nightingale. As we all know that she is a pioneer of nursing and she is also the founder of modern nursing. She was born on May 12, 1820. So the option B is the correct answer. Next question. Number of arteries present in umbilical cord. Number of arteries present in umbilical cord. The options are 1, 2, 3, and 4. The correct answer is 2. In umbilical cord, as we all know that umbilical cord means it's a connection between the mother and the baby. So it's a passage, it's a channel of communication between the mother and the baby. So it contains two arteries and one vein. Two arteries and one vein. So here you can see that two arteries and one vein. So our question was number of arteries. So it is 2. Next question. Suture present between two parietal bones. Suture present between two parietal bones. So the options are coronal suture, lumbar suture, sagittal suture, and frontal suture. So we know that cranial sutures means these are the fibrous bands of tissues which will be connecting the bones within the skull. So first is coronal suture, which means the suture present between the frontal and parietal bone. This is the explanation for coronal suture. The next is lumbar suture, which connects the parietal bones together with occipital bone. So it will be seen between the parietal bone with the occipital bone. Then next is sagittal suture, which will be present between the two parietal bones of the skull. Last is frontal suture. So it will be seen between the frontal bones. So these are the suture, cranial sutures. Our question was suture present between two parietal bones. Though, so the correct answer was sagittal suture. So here you can see that sagittal sutures. So this is the parietal bones. We have two parietal bones. Within this two parietal bones, there will be suture. That suture is called as sagittal suture. Next question. Inflammation of the breast tissue is known as, options are engorgement, breast abscess, mastoiditis, and mastitis. So we can see each one in detail. Breast engorgement means swelling, tightness, and increase in size in the breast. Some ladies, after the delivery, they will be having some kind of excessive secretions and excessive swelling over the breast area. So it can be seen associated with some kind of infections. Such condition is called as breast engorgement. Sometimes if the accumulation of milk can also cause some kind of swelling or pain sensation. Next is brain abscess. We know that abscess means pus formation. So there will be painful collection of pus that forms in the breast. That is called breast abscess, which will be seen associated with infectious condition. Then next is mastoiditis. It is a bacterial infection of the mastoid air cells surrounding the inner and middle ear. So out of these four options, this is the option which is away from the part of breast. So it is a kind of infection which can be seen in the mastoid air cells, which will be seen within the ear. Last option was mastitis. We know that itis means inflammation or infection. Inflammation of breast tissue that sometimes involves an infection. So this is called a mastitis. So our question was inflammation of the breast tissue is known as first option was engorgement. Next was breast abscess, mastoiditis, and mastitis. Correct option was Option number D, that is mastitis. Last question, fear of stranger is called. Options: zoophobia, algophobia, acrophobia, and xenophobia. We know that phobia means irrational or excessive or extensive fear to a particular object. Zoophobia, we know that zoo means animal, so it's excessive fear towards the animal. Algo means pain, so algophobia means it's a phobia towards pain or fear of pain. Acrophobia means fear of height. Some patients will be having acrophobia. Then xenophobia means fear of strangers. Some patients will be having some kind of fear towards the strangers from the out of their family or out of their cultural background. So our question was fear of stranger. The correct option was option number D, that is xenophobia. So that's all about today's topic. Thank you for watching.